Locations. So answer is almost obvious. So PCOMM is one of the commonest thing which we encounter in our day-to-day clinical practice. So as far as the aneurysm is concerned, the most common thing which we encounter is the anterior communicating artery and the posterior communicating artery. So both the communicating arteries are quite common in our clinical practice. So they may occur at either in the front of posterior communicating artery, that is at the junction with the PCA, or at the junction with the carotid artery. So when it is at the carotid artery, it typically points laterally, posteriorly, and inferiorly. So when it is projecting laterally, posteriorly, and inferiorly, so the main nerve which is associated with the posterior communicating artery is the oculomotor nerve. So because of the type of projection of such aneurysms, that is in PCOMM with the lateral, posterior, and inferior projection, so the oculomotor nerve will be involved, which will be compressed. So that is why in this particular, this is one such aneurysm where you will clinically manifest with anisocoria. So patient will be stable, that is GCS will be preserved, but there will be anisocoria when it is an unruptured aneurysm. Okay, so I will show that in the picture also. So you can see here, so this is the posterior communicating artery at one junction with the ICA and the other junction with the PCA. And this is the oculomotor nerve, which is related to the posterior communicating artery. So when you have, and this is the tentorium, this is the lateral view, this is the third nerve, and this is the posterior communicating artery, the basilar artery, the PCA, and then the ICA. So now when you have a lateral, inferior, and a posteriorly projecting aneurysm, this aneurysm is going to be in association with the third nerve, which results in the compression of the third nerve, which can present with anisocoria. So this anatomical orientation is very, very important. And the other thing is the relationship with the tent, the posterior communicating artery and the tentorium. So I will tell you when I am telling about the types of the posterior communicating artery aneurysm, how this tentorium is related to the types of the posterior communicating artery aneurysms. So the other thing is anatomical variants of the posterior communicating artery. So in anterior communicating artery, most of the times, more than 70% of the anterior communicating artery aneurysms have an associated anatomical variants in the anterior communicating, like fenestrated ACOMM or duplicated ACOMM or asymmetrical ACOMM. So various anatomical variants are there. Similarly, for the posterior communicating artery, also there are certain anatomical variants. So this one such as the commonest one is the fetal PCA. So where the P1 PCA will be hypoplastic and the fetal PCA will continues as the posterior communicating artery. Okay, so that is the fetal PCA, where the fetal PCA is called when there is a hypoplastic P1 PCA, P1 branch of the PCA or P1 part of the PCA, where the P2 PCA continues as the posterior communicating artery. So this is called as the fetal PCA. This is one common anatomical variant associated with the posterior communicating artery variant. And the other thing is the infundibulum. See, we need to differentiate the infundibulum from the aneurysm. So we should always keep in mind of the infundibulum. So infundibulum is a normal anatomical variant which is usually associated with the funnel-shaped dilatation of the artery from its origin. So that is called the infundibulum. So this is a normal anatomical variant and there is no need to address the infundibulum. Okay, so that should be very, very clear. So you should differentiate this infundibulum from the aneurysm.